Welcome to today's podcast. Welcome to Voices Unfiltered. Let's talk about psychology. Psychology is often described as the science of understanding human behavior, emotions, and mental processes. Millions of people around the world seek psychological support to overcome anxiety, depression, trauma, relationship difficulties, and many other challenges. But an important question sometimes arises. Is psychology always a tool for healing, or can it become a tool for exploitation? At its best, psychology helps people understand themselves better. A skilled psychologist provides guidance, evidence based treatment, and a safe environment where individuals can discuss their struggles without fear of judgment. Many patients experience life changing improvements through therapy. They learn healthier coping mechanisms, gain confidence, and develop a stronger sense of well being. However, critics argue that the relationship between the psychologist and the patient contains a significant power imbalance. Patients often seek help during vulnerable periods of their lives, placing trust in professionals who possess specialized knowledge. Because therapy sessions are usually paid services, some people wonder whether financial incentives can sometimes conflict with the patient's best interests. One common concern is the possibility of unnecessarily prolonged therapy. If a psychologist benefits financially from regular sessions, could there be a temptation to encourage a patient to continue treatment longer than needed? While professional ethics require psychologists to prioritize patient welfare, skeptics argue that the risk cannot be completely ignored. On the other hand, mental health issues are often complex. Recovery is rarely immediate. Just as physical rehabilitation after an injury may take months or years, psychological healing can also require long term support. What may appear to be excessive treatment from an outsider's perspective may actually be necessary for lasting improvement. Professional organizations around the world have established ethical guidelines to prevent exploitation. Psychologists are expected to maintain transparency, respect patient autonomy, avoid conflicts of interest, and regularly evaluate treatment goals. Patients also have the right to ask questions about their treatment plans, seek second opinions, or change therapists if they feel uncomfortable. The key issue may not be psychology itself, but how it is practiced. Psychology is a tool, and like any tool, its impact depends on the person using it. In the hands of ethical professionals, it can reduce suffering and improve lives. In the hands of those who place profit above patient welfare, there is a risk of manipulation or dependency. For patients, awareness is important. A healthy therapeutic relationship should encourage independence, personal growth, and measurable progress. Therapy should empower individuals rather than make them feel permanently dependent on a professional. In conclusion, psychology is neither inherently exploitative nor automatically beneficial. It is a powerful discipline with the potential to heal, educate, and transform lives. At the same time, patients should remain informed consumers of mental health services, and psychologists must uphold the highest ethical standards. The goal of therapy should always be the well being of the patient, not the continuation of treatment for its own sake. Thank you for listening, and until next time, stay curious and take care of your mental well being.